We are live. 8 minutes, 8 seconds in. As I'm popping a gum, I probably won't keep it for too long. Ladies and gentlemen, welcome to my channel, Nursing Education Tutor. My name is Cheryl Spencer. I'm a few minutes late to this 8 o'clock live, but life goes on. And this is as soon as I could get on. So, as you can see, I'm in my car. Um, couldn't go home where I am. I had a 2-hour Zoom. I had to park on the side of the street. Oh, I chose to park on the side of the street, so I was close to where I needed to go. So let's see what's happening in the chat. So just say something in the chat so I know who's here. Welcome to the live chat. It's Tuesday night. Somewhere, somehow. Hello, Erica. Yes. I did go and check out your channel. I have to go watch some of the videos. I know the email now. So since we last, hey Amanda, since we last spoke, oh my God, yes I did. I am that person. Come on. I'm like, this is a very unique name. So I went over to the channel, but this is how I learn, Eric. I'm telling you. You know, just like everybody else, I'm sure there's a club out there with my haters, and you know, I live for that. But I like the person I am. I try to build, I try to grow, and I try to learn. So sorry, Mama T late. Oh, for real, I've got the tea. um, yeah. When I get some chances, I'll go take a look and see the video. Actually, you know, a student, of course. I'll get to why you're all here. I mean, you're not just here because I'm cute. But I put on a little business sweater today because the Zoom that I left after I left you is the org. Give the tea, spill it. I'm coming. Um, the Organization for Associate Degree Nursing. I'm on the board of directors, and once a month we have a meeting. We have a once a month meeting by Zoom. So I knew Zoom before this crisis, and then twice a year in person. Hi, Asmal, how are you? Welcome. So I had to go by my family. So I was like, okay, let me drive halfway, stop on the side of the road, found a spot, did my Zoom, then went there, and I'm trying to head back home. So I'm in some shopping parking lot as I tried to find a light. So there's some light like right in front of me. I was trying to find a light that I could, you know, under my sunroof. But anyway, there's a light right in front of me. I'll probably turn the car back on. But anyway, enough of me. Welcome to my channel. It's Tuesday night. Oh, it was so funny earlier. Like, you know, and I do understand the stress and the anxiety of a test, but you know, students always feel like one group is getting more. And believe me, when I tell you this, we all teach it a little bit differently because we're all a little different. Let me see what it looks like without that light. Oh, I need it. We all teach a little bit differently, and we all have different clinical skills, but at the end of the day, we use the same curriculum. We may teach it differently. As I was mentioning to, I think who came on the Zoom earlier, Avril and Jamie, that up until yesterday, myself and Professor Reichart were still looking at that exam, scrutinizing it, making sure the content is content that's part of your required reading, even though it's a lot. But if there's something that we felt you know, we haven't, I mean, it's not required yet. So we try our best to. We can't make it easy. You know, the NCLEX is going to make it easy. But anyway, enough about me. I hope you're all having a good day. Let's see now with the chat. So hit me with the first question. So it's Erica and the tea lady in Osmal. So again, just make it a question. And it's not that I'm going to be talking constantly. Just see, you know, it's kind of hard doing it a chat on the phone. So let's see what we got. as I'm chewing as I'm chewing Mentos gum. So because I'm a couponer. I mean, I get free stuff all the time. I mean, by free I mean I buy it first, and then a certain app. What are we talking about? What you talking about? Girl, that test tomorrow. All about that test. I'm all about that test. About that test. No cheating. Okay. So what's the right order to don the PPE? I can go for days. I'm gonna watch a video. So again, who asked the question about the PPE? To put on the PPE. Well, it depends on what it's. I'm trying to get you away from this memorization. If you're memorizing, probably more important, what's the correct order to take off the PPE? You can put the PPE on. I mean, you're not a surgeon. You're not doing any sterile procedure. You've washed your hands. You're touching everything. What's the right way to put it on? Could care less. What's the right way to take it off is far more important, because your PPE now. So let's say I put on my gloves first, or for doff. Okay, taking it off. Correct. So taking it off. I think we talked about that earlier, but we're in a personal setting now. So when you put on your PPE, first thing that you should consider, what part of your PPE is going to be the dirtiest? Somebody type that in the chat. What part of your what PPE is going to be dirtiest, most contaminated, most at risk? That's what you take off first. Exactly. So that's what you take off first. You're not going to now take something that's so contaminated and now touch the rest. Exactly. So if you look at it that way, without memorizing, think about the scenario. You work with your hands. Your hands are going to be the dirtiest. The last thing you want to do now is to take these dirty gloves and go touch a sink, which you probably, most of them have automatic, or touch your goggles, or even touch anything. First PPE to take off, I would memorize, I'm taking off the most contaminated. Oh, somebody just pulled up next to me. I'm locking my car door. I don't trust nobody. you know, take them off. So now that you've taken off your clean gloves, hey, trust me, honey. I mean, listen, I went to New York City public school. I mean, I could fight. I never had to. But, anyway, got my gloves. Remember, dirty gloves, dirty gloves. Glove to glove. Let's all move to Florida. Oh, where all the child molesters are. I'm just saying. Glove to glove, right? So now you've taken off your dirty gloves, right? Now, based on what else you have, if I have on a gown, oh my God, they're kind of crazy. Oh yes, because if they're homeless, they can hang out where it's warm. In serious, hey Melissa, no, seriously, in proportion, they tell you that there's per ratio, or whatever they put it. There are a lot of child molesters in Florida. I hate in Florida. I do have stuff there. Anyway, so you've taken off your gloves. You can now reach back to pull the string on your gown back. I know sometimes people if you were to listen to the CDC and do it correctly, you would probably take off your gloves, right? Wash your hands and then take off the others. If that's ever a scenario, do that. The CDC has given you a second option. I'm going to use this example. Melissa or anyone, if you have a patient who is on contact precautions, anybody, tell me what PPE will you be wearing in that room? Patients on contact precautions. Wait for it. Okay, gloves and gown. Exactly. Okay, Asma, you're missing something. Gloves and gown, contact, so we lean up against the patient's bed, and that patient's, itchy, kitchy, yaya, contact, right? Your gown could be contaminated, and your gloves could be contaminated. So the CDC says any contact or any, it's usually contact, it's really because of contact while you are wearing a gown. Tuberculosis doesn't come through skin. That's why it's airborne. Contact, C. diff, can come on your gown and then, or your uniform, and you could take it to another person. So Centers for Disease Control has given a second way to take off or doff. Doff, off. And with your dirty gloves, because remember in asepsis, it's either clean or dirty. You're now in the patient's room. You did something. It could be something as minimal as take a blood pressure, but whatever. Your hands with gloves has touched that client. Your gown might have leaned up against that client bed. They tell you that you can take your gloves, just as I am, and grab your gown. Remember, you tied it loosely. It's not lead, it's not heavy cotton, it's a very soft barrier, the gown, and you could pull that off slowly, right? And then in your hand, you start to pull it where it's just the glove to glove, and then you take it off and then wash. CDC gives you that one option. But post caring for an individual, when doffing, taking off PPE, you're taking off the most contaminated, dirty stuff first. Unless you're working with your feet, your most contaminated, dirty place is always going to be your gloves, so those come off first. That's as far as testing. We're not going to test you 5 things about which do you take off first. We have bigger things to do, like the patient is short of breath. What do? That's my answer to that. Next question. So whoever did give that, somebody else. Hey, we got 12 people. We got a good party going on here. O2, what's the question? That's not a question. Oh yeah, O2 like Fowlers. You and Vidya, or definitely not. No, patient short of breath. I'm raising the head of the bed first before I assess the lung sounds. Patient is short of breath. You go into a patient's room and they're lying flat and they're short of breath. Raise the head of the bed. Then do the lung sounds. Chances are raising the head of the bed. But seriously, this is on next exam. But just remember, with nursing, you always have to reassess. So again, remember the context in which we give you the question. A patient was lying supine. Never a good idea unless I'm doing some procedure or assessing your abdomen. Nobody should be supine. Patients lying supine. After repositioning, sometimes we don't say supine or whatever because you're memorizing those. After repositioning the patient, i.e., raise them up, what should the nurse do next? And it depends on the choices. It depends on the choices. If sometimes just raising the head of the bed, patient's good. And by reassess, remember you said the patient was short of breath, and by short of breath, are you going to put it very objective to say that the respiratory rate was 25? So if you're saying patient's respiratory rate was 25, you raise the head of the bed up, and a few minutes later, you reevaluate. Patient's respiratory rate's now 20. We're good. Not everybody who's short of breath needs to be the doctor to call. It's not an emergency. It was just a problem because the patient has heart problems and shouldn't be lying flat and somebody forgot to put their pillows. Hey, Professor. Hey, my favorite student. Oh, I shouldn't say that. There's some other people in here, Cody. Cody, we got some fundamental students on the live. Maybe you can answer some of those questions. Next question. Hey, I keep telling them every teacher has a favorite student. We lie about, well, I wouldn't say we lie about it. We just have a favorite student every week. Do you add rationale to, who said that? Rationale to planning or implementation? Good question. So rationale, who asked that question? Maybelline Baby Lips. I have about Which is the man? Okay, slow down, slow. Let me answer that first question. Let me answer the question about care planning. Imagine you have a Word document and it's in landscape form, like what's in your book. You have your assessment. I'm talking nursing diagnosis. Okay, Melissa, good question. Good. Um, I'm, I, we actually put them in a column to make life easier for you. So if you consider nurse, so we're going to go nursing process. The first column is your assessment. Objective data, subjective data, however you want to put them. Want to put them together, whatever your data is, right? You've now decided that you have a problem. You could put the nursing diagnosis in the bottom or next column. Then during planning phase, right? Planning, you're going to set your goals, right? And the goals have to be set in a manner that they're measurable. Maybe not by you, could be by some. Hi Cheryl, I just saw the email today. You're, oh God, who's somebody sending me a message at 8:28 about work. So you want to put your measurable goals. Patient will maintain respiratory rate between 18 and 22 by tomorrow, one day. Specific, measurable. That is the goal. How are you going to get that? If you're going to keep the patients at either semi-Fowlers or Fowlers, you're going to encourage cough and deep breathing, you're going to administer the oxygen if ordered, blah, 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 all the interventions. Now, Melissa, here are the rationales. I like to have students right where you put each intervention. If you put intervention number 1, keep patient's head of bed elevated to 45 degrees. In the next column, rationale number 1, you're going to say page 455 in the book says optimal position for breathing is this position. Rationale number 2, it could be the same page, but if you put five interventions right next to them, should be the rationale to say that you didn't just make it up because your grandmother told you that this is good for something. You're giving the rationale reason from a source that was either your textbook or some other peer-reviewed source. So that's kind of how we expect you to put the rationale. We want you to put the rationale next to the intervention. Basically, how did you know that a patient on bed rest should have range of motion? Page whatever in your textbook says that immediately put on bed rest, range of motion is done to minimize. No, it's not an implementation, Erica. It's a separate column. It's just a column. You're writing the care plan. You're writing the rationale before you do anything. You're writing the care plan. A patient has shortness of breath. This is what we're going to do. The rationale is the reason why we're doing this. And then the last column is evaluation. So it's just I see what you mean. It's implementation is I guess. I apologize. I guess that's what it is, but we don't consider that. It's just the reason. So it's yes. There you go. Just a column. There you go. It's just the reason. I've seen care plans where there's no rationale, there's no reason, or they just put on the bottom. Yeah, oh yeah, in your book, yeah, in your book, yeah, you and guess what, Erica? Guess what? You're probably not gonna see it. Yeah, but I know what you mean. But again, just so I think you do have to do a care plan at some point. So under, because most places don't use care plans. I'm telling you, they don't. It's Smithsonian in many ways. And I said it. But however, nursing process is how we assess and we assess and we assess. The process is amazing. But this whole idea to make you think that you're going to be sitting there and writing down this care plan for a patient, it's false. It really doesn't. It doesn't exist that way. And until, as you said, Erica, until you get there to see it, we can't. Yeah, but um, are there any care plans on this test? I'm not sure. I don't think so. Next question. Oh, my light is good. Look at that. My light is good. Which is, oh, that, I'm sorry, you're mandatory for accreditation. Well, oh no, you asked it before. Well, it's not that which is mandatory. Um, the question is, you should ask, is accreditation mandatory? That's a better question. Is accreditation mandatory? The answer to that is, anybody? Now, sometimes it's good for another student to say it, so you, yes, it is. Yes, it is. Man, girl, I'm done. My job here is done. Vidya, Dave, and Buzz. Hey, Dave, my job is done. Perfect. That's all you need. No. Hold on. Okay. Exactly. Volunteer from AC and all them commercials. Shout out to Dave. Excellent. And and Vidya them. So you live in New York State. In order to take the NCLEX, okay, so I don't think you're understanding. Just wait a minute. Hold off on the typing and listen for a minute. New York State accredits all nursing schools in New York State. You cannot take the NCLEX if you're not accredited by your state. New Jersey State accredits all nursing schools in New Jersey State. Period. I'm sorry. Point blank, period. That's my 21-year-old niece. I swear. Point blank, period. That's the minimum mandatory. If all they want is that, that's it. Now, okay, I got you. Now, let's say you want to find some other places that ask you to jump through some other hoops and show that you're just not minimum. You do the maximum. You can do an extra voluntary such as ACN, right? Go. I'm telling you, I live it, people. I live it. ACN, right? Or the NLN, right? So again, minimum. What is the minimum accreditation required for any nursing school? State. That's it. Gonna do extra. Now, while I'm on the subject, you'll hear hospitals talk about certain things, magnet certified. Those are extra and wonderful and all those types of stuff. Minimum for the schools by the state. Now, who determines what you do? The ANA tells you about practice, and the NLN tells you and teach and about teaching. So if you want to look that deeper, but that's just kind of how I teach you to memorize that. That was a good question, Amanpreet. That's good. I think I'm glad other people know about that. Wait, shout out Vidya. What's up, Vidya? Hi, Vidya. Next question. Hey, I went to CVS today, girl. Hey. Let me see what I got. Show Vidya. CVS. My store. Hi. My initials. Okay, next question. Make that money. I'm telling, there's this bright light from this deli light just shining on you, girl. I have my overhead light. I'm so good. This is plenty. This is good. Who needs all that ring light? And it's like shining right in my face. You see that, right? Next question. Hello, Professor Aziza Esther. How are you? What you got? I know. So, okay, hold your questions off for a minute. Just for a minute. Listen. We all tell you to get a good night's sleep. The reality, I know a lot of you are not going to get a good night's sleep. We know that. find a way. What time are you guys going to bed tonight? Anybody? Who's still studying? Carrie says after the test. That's funny. Oh my God! It's so It's so stressful. It's so stressful. Like I tell you, as I see you all here, this is just validation that teachers teachers should have some type of communication with you the night before every exam. Who would agree with that? I'm not saying that I'm giving you what you need, but I won't. If you ask me something that just you could leave for next time, I'll leave. If I spend a little time talking on it, it's, you know, me. Yes, honestly, I got a shout out to she's in upper semester, and her name is Samantha, and she was the one that really said, Professor, you got to do this channel. Professor, you got to do this channel. I'm like, why do I want to be on YouTube? I mean, I see you guys at school. And she goes, no, Professor, no, Professor. She's like, oh, they like that stuff. And for some reason, they like videos in the car, which makes no sense to me. I would never, as you can see, I'm parked. I would never do this stuff I'm driving. I think that's just so unsafe and distracting. So like you said, I'm parked. I'm parked, and which is fine, unless I'm so good at driving, and I definitely wouldn't do that. But I hope that somehow, if you can get one thing, if you can get one thing from tonight that helps you, I think it's worth it. Like I said, um, like a good 30 minutes from my home, but I just figured let me just pull over here because I do promise 8 o'clock. I was spending time with my sister, has a little 4-year-old granddaughter, and she likes her auntie, and we get along, and I was spending some time with her. She turned 4 Valentine's Day, but I was away, so I went and gave her the guilt gift, the super guilt gift, and we had a good time. I was singing. My balloon was the mic, and she has something playing the guitar, and yes, I had to leave. Auntie, you leaving? Yeah, I'm leaving. Will there be any? No calculations, Melissa, but I think the calculator is there. We talked about that. No, no calculations for this exam. Nope. Avril asked if you went to CVS for girl. No, that's at Walmart. Whoo, honey, that is at Walmart. That is at Wally's World, and I got you. I got you. I'm telling you, next time I see you, I have. But the Walmart only has the yellow one. Walmart has candy bars now, people. They have the mini M&Ms, all dipped in chocolate, and it's so good, so good. Um. Okay, next question. So y'all do some of the talking, not me. Oh yeah, I hit up CVS today. Vidya, I have about $55 worth of extra bucks to make some magic happen come next Sunday. Oh yeah. Um, so I guess we're quiet. I don't see any more questions. Let me out somebody. So Cody, how are you? When to assess vital signs. Okay, so okay. When to assess vital signs, when to take action versus when to notify the physician. Okay, so that's a loaded question. Also, can you clarify with wounds as they clean? Okay, so let me. Okay, so Dave, I'll answer your vital signs after. Let me do. So Vidya, no wounds on this exam. No wounds on the. So Vidya, so no wounds on this exam. What's on this exam on your blueprint are risks of immobility If you're immobile, what are you at risk for? Okay, well, let me answer this question first. What are you at risk for? Pressure ulcers. How do you assess? Yes, DVT and pressure ulcers, bed sores. So how do you assess those? I know sometimes you guys laugh when I say what's in the blueprint, but I'm really just trying to get you to go back to that. If you go off it, you go way too far. Yep, there you go. Braden scale. Exactly. How do you assess? Use the Braden scale. What would be considered a pressure ulcer? Yeah, what's a pressure ulcer, Melissa? What? Let's go small. What's your smallest first type of pressure ulcer? And then I'm coming to Dave. I have my fingers crossed to answer your vital signs. I didn't forget. Pressure ulcer. Yeah, we got the Braden scale already. The Braden scale is just a tool that tells you the risk. You're gonna look at the person. Yeah, there you go. There you go, Annie. There you go. There you go, Annie. Stage one is redness. Stage one is redness. Yes. Ooh, intact skin, red, non-blanchable. Exactly. Just saying. Anyway, so the minute the skin is broken, it's a stage two, right? Good, good. Mm. Okay, back to Dave's question. That's all I got to say about that. Back to Dave's question. Um, I got you. What did I say? I just shook my earrings. I don't know. Um, for a little itch. My ears was itching me. I'm sorry. Um, yeah, so Dave question. Okay. When do you take vital signs? So I know I did in my lab, and I'm sure others did. On the doctor's order sheet, the physician or whoever the provider, nurse practitioner, they write the frequency of vital signs. Person comes into the emergency room, part of the medical record, patient, the doctor writes the diet. If it's a regular diet, then that's fine, whatever. It could be a sodium restricted diet, it could be a sugar restricted diet, it could be a food restricted diet. But the doctor also orders the activity, bed rest, I tell you. And they also order the vital signs. So if you have a patient who's in with a vital sign type of problem, if a person has hypertension and they came in with exacerbation of their hypertension, their blood pressure frequency is going to be ordered much more frequent than somebody who came in with a broken thumb or wrist. So the initial order is from the provider. Now, the nurse has judgment. They write the blood pressure every 6 hours. And in, let's say in LIJ, every 6 hours is 10 a.m. or something, and the CNAs take the vitals. Now, for some reason, at 12 o'clock, you go into the patient's room, and the patient seems very uncomfortable with something. As a nurse, I can take that blood pressure as many times as I want. You can take any of course. Listen. You have enough to do. You're not going to waste your time. You make your judgment. I go into a patient's room. I'm doing their peripheral vascular assessment. I'm checking the pulses, and for some reason the skin seems really, really warm. I can take the temperature. So when I call the provider, I'm like, hey, I was checking the patient's pulse. By the way, the pulses are good. Everything's popping, but patient's got a temperature. So to that question, it's the initial orders from the provider, but the nurse can make the judgment as to how frequent. And the nurse can delegate that to a CNA, nursing assistant. We used to ask this question, it's definitely not on this test, but we used to ask a question with related to, it may come up, it's about judgment, which, if I have 4 patients, so you think about that. If you have 4 patients, and they all need vital signs, right? You have 4 patients and they all need vital signs. Oh, what's I don't know what the last one is. Two. Anyway, so you have four patients, and they all need vital signs. You, the nurse, you're going to decide which one of these, if any, I could delegate to my CNA. Now, if it's somebody who's stable and just on routine vitals, I could delegate to the CNA because it probably don't need to be taken anyway. But if I have a person who's critical and is going to need me to be there anyway, then you decide let the CNA take that one. That's how you make your decision. So let me just see what this is. To ask a different and really for textbook testing, your patient is having new or worse. Give me a second. Um, hmm, 1 second. Your patient is having new or worsening shortness of breath. Yes, honestly, Dave, the priority would be to raise the head of the bed. If your patient is having new or worsening shortness of breath, raise the head of the bed. The time you take to, patient's already dying and shortness of breath, like now you're going to come telling me to exercise. Like what part of did you get? So whenever your patient is short of breath, if there's ever an option to reposition them, that comes before pulling out the stethoscope. Make sense? The priority is to raise. If there is no positioning, you have to listen to the lung sounds before you run to call the doctor. It sounds crazy because you're thinking, I can tell the patient's short of breath. They're already short of breath. Why do I need to listen to the lungs? Well, it could be rails, it could be rhonchi. And if it's rhonchi, what you gonna do? There you go. Exactly, Dave. In real life, like really, absolutely. Let me just see this real live chat here for a minute. Someone wants their sleep. Oh, someone wants their sleep medication. Although I think I put this. This is one of the questions I put on my little thingamajig. Wait a minute. Someone wants their sleep medic, although it's scheduled for sleep time. The patient wants to sleep before eating. It was part of. Well, we don't give sleep medications in the daytime. You're going to say that to the patient nicely, and based on the choice I gave you, that was not said nicely. So you're going to notify the doctor. Yeah, that question got you. The patient did not ask for sleeping medications. I said the patient has an order for sleep medications. It was deliberate. The order says the patient has a medication for sleep. The patient says, can I take a nap before lunch? We don't give sleep medications until the bedtime, but the way that was, you want to tell them nicely that no. You want to say it in a therapeutic manner. No. So that was not therapeutic. Let me just see another question here. This is fun. Ronkai. What's the answer for Ronkai, Erica? Somebody tell Erica. You auscultate Ronkai. What you do, girl? Somebody tell Erica. But don't we need to make sure they eat? I'm sorry. I'm a preacher. Jump to something. What about eating? Where's the eating come from? Patient short of breath. I could care less if they eat. They may not. Oh, I could care less. Breathing. You can live a long time without. You could live a long time without food. Don't you read the Bible? 40 days, honey. Protein stores are good. Ask any good Jewish boy or Christian boy. You could eat. You could go. Muslim, as a matter of fact, they fast. Go a long time without food. Air. I'm just saying. Food is way down there. Food is like number 3. Food comes after pain. Breathing, breathing, breathing. Tell them to, there you go, Melissa. I'm telling you, honey, food, please. Tell them, Melissa. Tell them to cough if it's Ronchi, right? If they cough, don't cough on me. Sorry. Don't cough on your girl. I got you. That's what you do. Next question. Let me see. Did I miss anything? Oh, yeah, that's funny. Oh, no, food is, honey, trust me. As a matter of fact, the patients always complain they don't food. Position them. Yeah, position, then lung sounds, carry on good. Position, lung sound. I would even say position, assess, notify. There you go. Perfect. Okay. Meds. What about the meds? What about the meds? My family think I'm crazy. Listen, this I'm telling you, this y'all think this is what I was doing today, in the car doing the Zoom, um, watching a whole bunch of stuff. This is good. I'm telling you, the light's not too bad. I'm telling you. Next time I'm around the family, I'm gonna stop right here. This spot. Let's see. We got some. Well, I'm not going to none of those stores. Let's see. Okay. All right. I'm not asking. I'm not answering that question, Erica. Nope. Sorry. Nope. Can't. Right. Osmal answered it. Apical pulse. That's so funny. Um, honey, where's my super suit? It's my favorite. You do that. No, I didn't. I didn't say it was you. I'm sorry. Never mind. Never mind. Honey, where's my? I don't know what that is. Anyway, this is fun though. What are the priorities for immobility? Okay, well, what do you mean? Don't make them immobile. Better question is, when a patient is immobile, oh, you're my mom. Get off of here. When a patient's immobile, um, what do you do? That's your question. Okay, all right. So, Aziza, there you go. Your patient is immobile. Change. Okay, so Maria, by changing position, what do you mean? Move them. Okay, move them a little bit more. Spell it out. Spell it out. Yes, every 2 hours. Turn in position every 2 hours is a nursing intervention. Erica, what are you going to put right next to that nursing intervention? Move them every 2 hours. Yeah, but yeah, check for bed wrinkles. Good. Who told you that? Where'd you get that source? Yes, that's your rationale. The book, page, whatever says, yes. This is how. Right. Rationale. You're going to, yes, you're going to hear my voice like, oh, it's that chick. Better say chick. Don't say nothing else. Oh, I hear that chick's voice. The book, the source, exactly. Page, whatever says, this is what you do. But somebody was saying something that I wanted to look at. Okay, so yeah, back to, so, okay, so what else do you do to prevent immobility? What else? What you said turn every 2 hours. Something else we got to do. What else do we do? We turn in position every 2 hours. Great. Hygiene. Okay, that's the word right there. Range of motion. Yes, range of motion to prevent contractures. Good. Excellent. Now, the person who said hygiene, um, um, you want to keep them clean. If the person is not cleaned, or if they're incontinent, but it's not. Who said yes? Yeah, yes, right. Hygiene, of course, is important, but I'm talking immobility, complicated immobility. You want to pressure ulcers, contractures, and DVT. Heparin is off. Very good, Carrie Ann. So one of your intervention is heparin to prevent. Right? So heparin to prevent, right? And so you should know all the issues with heparin. Uh-oh. Okay, DVT, exactly. To prevent clotting, right. I don't know. Deep breathing. Okay, back to deep breathing. Hey, Nikki. Hey. We have some upper students on the live. Y'all are lucky. Hey, My job is done. I'm going to chill. Let them answer them questions. Hey, Nikki. Yeah, I prevent DVTs. Okay, fine. So the doctors ordered heparin. And I'm sorry, the nurse practitioner had PE, right? So the doctors ordered heparin. You've never given heparin before. You haven't even touched the syringe. Well, to the best of my knowledge. What's your concerns with heparin? You're going to check PTT. That's the lab level if it's ordered. Excellent. It probably isn't, but if it's ordered. Any other lab levels for bleeding? That's the word. It's okay. Spell check is good. We know this, right? So bleeding, right? You're going to assess for signs and symptoms of bleeding. Bleeding gums, you know, extra black and blue marks, right? Those types of stuff. Yes, don't forget your platelets, you know. So which of the following lab levels, you know, Osmal, I wouldn't expect orthostatic hypotension with a sub-Q heparin. This is just, okay, so if the person is bleeding, right, so don't push it too far. Remember, I keep telling you, the heparin that you're giving this patient, it's a small amount. It's a small dose. 5,000 units sounds like it's a lot, but in the big scheme of heparin, it's very little. But indeed, if you suspect somebody is bleeding, they could be bleeding internally. So a drop in blood pressure, and I'll teach you later. You know what? If the blood pressure is low, many times the pulse is high, just trying to compensate. So that's why vital signs are so important. You seldom treat the vital sign. The vital sign tells you something else, except maybe for temperature. But again, even temperature, you have an infection. So you're not just going to give them Tylenol. If you never treat the underlying infection, you'll just be forever giving Tylenol. So many times the same thing with a heart rate. A heart rate can tell you, let me ask you, what are some of the things that can raise your heart rate? Stress? Oh. What you know about that? Night before the exam. Pain? I'm sorry, I had to, Erica. Activity? Yep. Very good, Osmal. Activity. Okay. That's exercise. Yep. Exercise. What else? There's a whole lot more stuff that can raise your heart rate. Bleeding, sure. Bleeding if your blood pressure drops. So bleeding if your blood pressure drops. So it's the drop in blood pressure that causes the heart rate to go up. Pain, peoples. Somebody did say that. Hormones, yes. Trauma. Temperature. Elevated temperature cause the blood pressure, can cause your heart rate to go up. Good. I have a question completely unreal. Okay. All right, next question. Let's see. How are we doing? I was going to say that I was not sure. Not sure about what? Trauma? Hormones? Caffeine can raise your heart rate. All them energy drinks can raise your heart rate. But the main ones that you'll probably see that you're probably patients uncomfortable, patient temperature, patients in pain, caffeine, Red Bull, rum. I don't drink that stuff. I don't. Certain meds, absolutely. I'm trying to figure anything else. Okay, next question. We'll go to 9:15 because I really gotta head to the. I was thinking about temperature. Oh yeah, oh come on, temperature. Oh yeah, temperature. Many times that's why the nurse, you go in to check routine vitals. You go in to check routine vitals, or the nursing assistant come back and say, the nursing assistant come back and give you the vitals. You're like, why is this person heart rate 99? And okay, you're going to be like, well, technically that's between 60 and 100. So if they come and tell me the patient's heart rate is 99, the first thing I'm going to do is try to figure what's the patient's normal heart rate. The patient's heart rate a couple hours ago was 70, even though 99 is still within normal limits, right? Within normal limit, there's a big difference. So you want to get more information. You want to get anxiety. Yeah, you just want to get more information. So your assessment is always there, always there. Your vital signs, that's all they are. Like, hey nurse, what part of high don't you get? I'm trying to tell you something's wrong with me. Try to figure it out. That's what vital signs are. So when healthcare workers, and some of them fudge the numbers, it's really unethical. It's negligent. You're really supposed to take the vital signs. No math? Yeah, no, I know. Yeah, I'm just scrolling. No, no. I'm sorry. There's no calculations on this exam. Yeah, no, there are no calculations. You're welcome. Carrie Ann, does this mean you have anxiety, stress, or pain? You answer the question. I'm just being bad. Oh, I'm just asking. I thought that was really good. I like 21 of you on tonight. I think that's really good. I think that's really good. So I know sometimes you think we're so removed from it, but just a little nervous for tomorrow. How about circadian rhythm? Yeah, I mean, that's normal. I mean, that's normal, but circadian rhythm is not going to make your heart rate go over 100. I expect if there's no calculation, um, with circadian rhythm, you do expect later in the day, just hormonal and just that later late afternoon, 5 6 o'clock. Chances are your temperature, pulse, blood pressure, it's probably the highest it's for the day, but it still could be normal. It's still normal. You could have a heart rate of 95 at 5 o'clock, but 95 is still normal. Perhaps during the rest of the day when you were calm and not everything, it was 70. So as long as it's within normal limits, heart rate between 60 to 100, there's no intervention. Patient's heart rate is 95. It's within normal limits, so it's okay. However, if you're given a scenario that the patient's heart rate is 95, but the patient normally is 70, then let's look and see maybe there's something going on. Just like the elderly. I don't expect them. Yeah, some of them can get a temperature 101 point something, but we're not waiting that long. Once it's over 100, we're concerned because of normal signs of aging, liver, kidney, immune system. They may never get that high. So, it's not, I think sometimes we're teaching you textbook, but they expect you to think a little bit more with some examples. Um, that's the best way I could put it. So like for instance, there was a question. I think yeah. So that question, I want to repeat that question. I think Osmal asked a question earlier in my lab. He said it's an NCLEX question, and it was which of the following was most at risk for a fall or something like that. And the four choices were, one was I had Erica cracking up on this one. A woman who is 9 months. Oh yeah, thank you. Tell them. NCLEX is that nursing? I thought it was EMT. Oh, I don't know. 9 months pregnant woman. Like that's normal every day. I'm walking around with a 9 month belly. The whole thought of that makes me want to, whatever. Then some young 16-year-old on a very low slope skateboarding. A person with hypertension and I forgot the last one. 9 months pregnant, correct. So the person who is 9 months pregnant and walking up a flight of stairs has two risk factors for fall. 9 months pregnant, carrying another human being, your belly all over there, off balanced, plus the stairs. That's two risks. The person who has hypertension may be at risk. The hypertension alone doesn't put you at risk, but the conversation was, had you been told the patient wasn't a specific type of medication, such as an ACE inhibitor, an allopril, same thing, that can cause orthostatic hypertension. So cut a long story short, a woman who's 9 months pregnant, I mean, baby girl, she's at risk for DVT because them swollen feet down there, that baby's pressing on everything. She's at risk for killing somebody because it's a rush. So that's what that was. That was. But it was a good question. It's a good question. Let's see. Guy in a bike or something. Oh yeah, they're young. They can survive the fall. Um, okay, one more question. One more good one. Make it good. And thank you so much for coming. I'm glad. I guess we'll get 100. Ain't nobody getting 100. Who are you fooling? I'm sorry. I'm sorry, Eric. I shouldn't. It's a rare occurrence. It's like a unicorn. That one there. An A minus is possible. I trust me, honey. I do not lie. I do, I do not. Your teeth are so bright. Oh yeah, yeah. I'm a little obsessed with teeth. What toothpaste do you use? That's so funny. I brush. I floss. I'm not partial to what toothpaste I use. The one I get from CVS for nada. Surgery without consent, is that assault? Surgery with that's assault. That's a whole lot of stuff. Touching. It's assault. Oh, assault or battery. According to your Spencer. Yeah. Yeah. So I've been obsessed with teeth. It's one of my big pet peeves that they don't. Yeah, physical. Yeah. Yeah, we're not asking any questions about surgery, but those are my there. Yeah, but floss is a um. Thank you, no problem. Dinosaurs verbally attacked. Um, yeah, please mouth care. Please do mouth care on them. Please do not feed them before you shove food. I have like this nightmare. Like I'm gonna be like 105 and some nurse or some nurse's aide is gonna come and try to give me some food, and I'm gonna like hurt somebody. They're gonna call my poor son. God, my poor son's gonna come up there and like, why your mother is not eating, and he's gonna be like, well, did you brush your teeth? It's like that. Assault. I believe assault and battery is tricky. Let me call my friend who's an attorney. I think it's assault. That may be assault. It's assault. For real. I'm telling you, I'm going to be 105. They're going to come try to shove some crappy, I'm sorry. They're going to try to give me some food, probably something. And I'll be like, you didn't brush my teeth. And they're going to look at me all weird. And they're going to be talking about me. And I'm telling her, I call my son, and I'm like, Mom, give me a toothbrush. The legal definition. Oh, there you go. Legal definition of assault is verbal threat, and battery is physical. There you go. Battery for beating. There you go. Don't do it. Big battery. So I'm gonna so spread had the typo. So spread the word. I didn't send my link yet. I'll send in the morning early. So a lot every clinical lab person, uh I still Asmal, they did clarify that it was battery. The book says so. Battery for beating. Um every lab personnel is gonna send you a link. So I'll send you a link tomorrow morning. I'll set it up probably 7:30 to check that you can hear me. And then I would say sign on like at a quarter to 8 or 10 to 8. And then, check it. So you'll sign on to Zoom, and then you'll sign on to ExamSoft, and we'll get through that. And I'm supposed to lecture after that. Like, y'all gonna hear anything I say, but we'll do something light. I know how that starts out already. Professor, there's one question that I can't answer. But I hope you have try to have a good night. Try to have well, you did have a lecture on sleep. All those things that you memorize, you're going to teach a patient what to do to get a good night's sleep. I propose you do those things tonight. And what are those things that are good for sleep? Massage. Yeah, you get somebody to give you one of those tonight. Good for you. A massage, good. What else? Very good. The tea. Oh, the tea. Erica, we're talking about the tea. Bedtime ritual. Y'all all past your bedtime already. What's your bedtime ritual? Oh yeah, so we kind of stay away from that warm milk. We don't talk because so many people have allergies. It works, but we don't put warm milk as a choice anymore. We kind of twinkle twinkle, yeah. Chamomile tea, peanut butter. Peanut butter works for you? No, we don't teach you peanut butter. We don't teach that. We don't teach those nuts. Nice massage, lighting, comfortable pillow, boo babe, providing they don't snore, good company. Correct, Vidya, but we don't test you on that anymore because we kind of lose the milk, the warm milk. If that's what's part of the patient's norm, yes. But the average patient, we're not gonna offer them warm milk. Um, Not offer them cheese either. Tell you, in the hospital, we're not doing that. A back rub is a good thing. Sometimes they get that. Bedtime, proper lighting. Ain't you know pineapples in it. Get out of here with that crap. We gotta put that pineapples from. They're sick. They're trying to get better. And when all else fails, what are we gonna give them? Don't you take them. Listen, you're home. Whatever works for you. Um, 22 per. Hey, Cody. That's right, baby. You got competition, Cody. Still my favorite. Don't tell him. Shh, 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 shh. Ambien. Yes, Erica. Yeah, we want to go the non-pharmaceutical route first because, they make enough money. And while medications are helpful, they have the potential to do certain stuff. Peanut butter and cheese, man. We ain't, listen. We ain't giving ain't nobody no peanut butter and cheese at night in the hospital already. I have to go figure out who has an allergy. I'm telling you. Leave it alone. Leave that stuff alone. These are the rituals. No alcohol. I know one you're gonna say, but Professor, that nice glass of red wine helps me. Where the heck are you gonna get red wine in the hospital? I want you to pretend that the questions we're asking you are patients in a hospital or a nursing home. Back in the day, patients could get a little bit of wine on their a lullaby. You know, I was singing tonight with my that little 4 year old. I had a balloon that said "I love you." She said that auntie, that's your microphone. She had a little long thing of bubbles, and it was her guitar. Her father's a DJ. My family's big on music, so we're there singing, and that's the story. So if I could, but I don't know for sure. I don't know for sure what. Hold up. Okay, yo, tell me where am I gonna get a pineapple at North Shore at 10 o'clock at night? People, I drink. Where am I gonna get? This is what you're gonna get in the hospital. A nurse or a nursing assistant has two hands, could give you a back rub. They should do that. They have control on turning down the light. We can do that. They have control on shutting up and not loud, controlling that. We can probably find you some tea. Doubt we're gonna get chamomile tea, but some other tea, as long as it's not whatever, something soft, no caffeine. Um, Chances are your bedtime routine back rub. I still can't get over how creepy that is. Well, hey, then don't get it. Trust me. If you're a 90-year-old patient who's been lying on a wrinkled sheet all along, they love a back rub. Trust me, they do. They do. Listen, they do. Um, and last but not least, we got Ambien. I'm gonna tell you. And we got yeah, I know. I get back rubs. I get back rubs. I I mean, well, in my business, I mean, not to get a back rub, range of motion. Yes, that's a medication. We're not, yeah, that's a medication. Like a multivitamin is a medication. Have you seen anyone sleepwalk on Ambien? Mm, I don't know. They come, probably not. I mean, they come to us so we probably wouldn't call it sleepwalking. They're just up. To be honest with you, they're probably just up. I'm not sure. I can't say that I have. I can't say that I have. Quality care is one of these things. I'm telling you, quality care is one of these things. We need more of it. We talk a lot about it, but for those of you who work in healthcare, you know that there are many instances where it doesn't exist. But there's a possibility to give quality care. We take on more than we can. We pretend that we're the only ones that do everything. When we find somebody who's doing a good job, like if we find a nursing assistant that we know they're good, encourage them to go to nursing school. Encourage them. I'd hate for a good nursing assistant to be working as a nursing assistant, but that's not their final goal. Help them, you know, show them that nursing school is hell, but teach them how to walk over the hot coals. Bam. That's what you do. I mean, I'm not trying to make this easy because this is not easy. There are days that I don't know how. There are days I don't even know how I do it. I mean, I don't even know what state I'm in, but I would never sit here and make you think that, what I do is, you can do it. It doesn't, you don't click it. He was like Dorothy, like, hey, bam, it takes some work. We need to show people how to walk over those coals instead of, oh my God. It's like, I had a 4.0 when I get in. Oh, that's a lie. The application states that's a lie. Stop telling that nonsense. Tell them the truth. I barely passed. And they took me. And I did okay. 18 people. Yeah, tell them. Yeah, who's that? You tell America, because I don't beg for likes. I find the whole thing so crazy, but I know how to smash that button, press that likes. No, honestly, guys, this is great. So I'm doing this Tuesday night before every test. Let me see them yeses or thumbs up. I am? let me see. I laugh when I see these people come on, and before they say anything, smash that button. They're begging, to me. Oh, woo! The algorithm helps you with likes. I know it does, but to me, it's, like I said, exactly what I'm doing here is the purpose of this channel. It's community service. It takes very little out of my life. I mean, I had to do some arranging to come on and talk to students to try to help to calm you down. So like I said, if only one student who's on this live tonight gets a question correct tomorrow, worth it. Completely worth it. Completely worth it. And for that, I say thank you. Now hold up. Let me do my sign off, because you got to be consistent. We miss out. Oh, Erica, you are funny. Wait, maybe I should press the like button. Hold up. I'm teasing. I'm just teasing. You are hysterical. I love it. 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 Thank you. All right, so here. So if you've been here before, I thank you. And if this is your first time to my channel, welcome. I hope you stay. Have a good day.